that this drug indeed works in the treatment of coronavirus. That's why they have clinical tests actually happening now in the country to determine whether or not it is useful. Nonetheless, the president said that millions of doses have already been purchased by the federal government and put in a national stockpile. And the president even suggested himself that he might even take hydroxychloroquine after consulting with his doctors. But again, Wolf, we need to note that there is no evidence so far to suggest that this is an effective treatment, at least no conclusive evidence. Wolf?
And before your doctor prescribes it, he or she should inform you of the potential side effects from this drug as well. All right, Jeremy Diamond, thank you very much for that. We're also following staggering new numbers out of Michigan right now, the state which only lags behind New York and New Jersey for the most cases here in the United States, has reported nearly 1,500 new cases today alone. And according to Michigan's Department of Health and Human Services, that brings the state's total to more than 14,000. Officials there also reported 61 more fatalities related to coronavirus today, bringing the death toll there to 540. Democratic Congresswoman Debbie Dingell of Michigan is joining us right now. Congresswoman, thanks so much for joining us. So if cases continue to rise like this, are you worried your healthcare system in Michigan will soon be overwhelmed?
Our healthcare system is already feeling it. I hear from nurses and doctors every day that are very worried about the PPE equipment in the hospital. We don't have enough ventilators right now, and we're doing everything that we can in a very bipartisan way, I might say, on our congressional delegation to try and get that equipment in here. And we're lucky that we have major manufacturers, both Ford, General Motors, all three, actually Chrysler, have stepped up in production of face shields, masks. Ford's beginning to produce the N95 mask. But the ventilators which both General Motors and Ford are going to make are not going to be online for this peak that we are going to see in the next couple of weeks. And yes, we are worried.
Is your state getting what it needs right now, Congresswoman, from the federal government?
You know, I don't think it's in anybody's interest right now to get into any kind of contest between federal and state government. There were shipments that were scheduled to come here that we had contracts for that were suddenly not shipped because the federal government was taking over distribution. Every single person I know is working on getting shipments. We are having, look, I spent yesterday trying to find a plane to fly equipment in from China. There are a lot of the manufacturers are working with contacts that they have. Everybody's doing everything they can to get that equipment in. We get a report at the end of every day what the burn rate is at every hospital and what the day's supply is of PPE.
Detroit's mayor, and you know this, Congresswoman, has actually floated the idea of a curfew for the city if people don't obey the stay-at-home order. Would you support that?
I would. I quite frankly have been in my house for 21 days, Wolf. Nobody would bet a penny that I could stay put for 21 minutes. But too many people aren't taking this seriously. And every last one of us has a job to do. And for most of us who don't have the skill set to be on the front line as a nurse or doctor, and I'm so grateful to those grocery store workers and those drugstore workers and the Amazon workers and the drivers of these trucks and the mail people. Our job is to stay home, and not enough of us are. They don't understand how important it is, and the only way we mitigate this is for each and every one of us to stay home, sit on the couch, and stop mingling with other people.
Yeah, that's excellent advice. As you know, Congresswoman, this is the time of the year when so many so-called snowbirds, retirees, others, they leave the state during winter, but now they want to come back home to Michigan and elsewhere if they've been hanging out in Florida or Arizona or other warm weather states. So what's your advice to them? Should they come back to Michigan right now or stay put in Florida, Arizona, elsewhere?
I think people need to stop traveling. I know it's really complicated. I've talked to a lot of people in both Florida, Arizona. A lot of them weren't taking it seriously down in Florida. They were stir crazy. They thought everybody was overreacting. Well, people aren't overreacting. And no matter where you are, whether your governor has told you to stay home or not, you need to stay home. Well, I've lost 12 people I know in the last couple of weeks. Not everybody's been, some of them were older. We don't know why they died. Even someone that very well known, a young person, 33, Graham Davis, was the mayor's communications director. His bulldog was named Dingle. they're now thinking may have had COVID. This is a real disease, and it's killing people from babies to, we had a 107-year-old. It is, people need to stay home. They need to stay put wherever they are.
Before I let you go, Congresswoman, what's your bottom line message right now to Michigan residents, so many of whom are so scared right now?
We're going to get through it. We're going to get through it because we're going to support each other. We're really lucky that we are a community. People are that need supplies at home. We're making sure you've got your food, your medicine. There are a lot of nonprofits working to take care of the community. We need to thank our nurses and doctors and all the frontline workers. But if we all do what we're supposed to do, we're going to get through it, and we're going to be stronger and closer because of it.
Unfortunately, I totally agree. We will eventually get through it. Unfortunately, in the next few weeks, a lot of people in this country and indeed around the world are going to die. And it's so sad. Representative Debbie Dingell of Michigan, good luck to you. Good luck to all the folks over there. Stay safe. We'll stay in close touch with you. Appreciate it very much.
Stay safe. Thank you.
All right, a growing crisis in New York. Now the federal government taking some dramatic steps, including opening a new hospital in the city. Can Americans feel safe sending their loved ones to hospitals, to these hospitals being built from scratch? We're going to talk about that and a lot more when we come back. Stay with us. You're in the Situation Room.